It is independent television, and the program is this morning on ITV. Now, we've got Dr. Pius Ononigwe, who is from the Africa Center for Disease Control, representing the body in Edo State here. And of course, he's also a member of the Edo State COVID-19 committee. We're going to be looking at the merits of the vaccination. And for quite some time now, it's been reactions and counter-reactions. Given the position of Edo State governments, some say is to encourage people to ensure that they get vaccinated, and why some other persons, kind of misunderstanding the whole thing, that the governor shouldn't say that people should be vaccinated, because for them, they see it more of a human rights issue. Dr. Pius, you're welcome to this program this morning on ITV. You're welcome. Dr. Pius, you're welcome.
Thank you very much.
You're welcome.
Thank you for having me this morning.
All right. Now, like what I always do anytime I'm talking about COVID-19, I try to see the NCDC portal first so that we know the condition. So quickly, we'll just see what it is in Edo State for today, this first day of September. And for today, we've got confirmed cases, 5,402. In Edo State, 316. It's for those in admission. And for those discharged, we have 4,891. Then for those that have died as a result of COVID-19, Edo State, as of today, stands at 195. Doctor, you're welcome one more time to the program. Now, let's look at the vaccination. What do you think are really the merits, the advantages of the vaccination? Let's start from there.
Okay, thank you so much. The vaccination, as we have always said clearly, is one of the tools that we use in fighting against the spread of infectious diseases. And as you know, there's what we call vaccine preventable diseases. Like conventionally, as we have always brought our children, or even some of us taking the yellow fever vaccine, the measles vaccine, even the smallpox vaccine. Take, for example, smallpox, we're able to nip smallpox to the bud through vaccination. Otherwise, would have been hearing of smallpox here, smallpox there. Even the current Ebola, we have been having pockets of outbreaks of Ebola in West African region. But it's because the time vaccination came on board, the ability of Ebola to spread so fast was curtailed because of the vaccination. Because whenever we have outbreak, as we are putting other measures, vaccination is always a surer way of containing it. And it's not different from COVID-19. COVID-19 has actually, for some time, been an issue affecting lives and livelihoods. So the question is, how do we get out of it? We have other measures. We have gotten the non-pharmaceutical intervention, like the use of face masks, washing of hands, and the rest. But just like it has always been the practice with infectious disease, we know that when you apply these vaccines, obviously, like COVID-19 specifically, the virus can always be contained if we have the vaccines. And what does the vaccine do? The vaccine, as data has shown us, as evidence has shown us, may not necessarily prevent infection for COVID-19 vaccine specifically, but it prevents death, disease, and the severity. And those are the things that we want to see. We don't want to see people dying. We don't want to see our hospitals overwhelmed, because there are other diseases that we are handling, not only COVID-19. But when the beds are occupied by COVID-19 patients, who, if they had vaccinated, we wouldn't see them in the hospital. We don't want to see people in their various homes because there are some of them that are not reported, but they are sick at home, and it's affecting their livelihoods. So with this vaccine, we are saying, even though with this, we may not prevent infection totally, that's people getting vaccinated and being infected, but we can prevent the disease it causes, can prevent severity, where people are looking for oxygen here and there, and we can also prevent death. And I also want to tell you that in this third wave, we have gotten 12 deaths, and 100% of them were unvaccinated.
In Edo State?
In Edo State. So imagine if these 12 were vaccinated. I can assure you that people wouldn't have lost either their wives, their husband. They wouldn't have had people who are now fatherless or motherless if these 12 were vaccinated. Since we have evidence that vaccination prevents death to almost 90%.
Okay, now the conspiracy theory is one big thing that is taking toll. It took the toll on the COVID-19 when we had an advent of the COVID-19. Then, of course, when we also had that experts were trying to find vaccines for the COVID-19, the conspiracy theory took a toll. Then now that we have the vaccines, various vaccines for the COVID-19, we also have the conspiracy theory still taking a toll. Now, for most people, they find it very, very difficult to believe that COVID-19, the vaccine and all that. Now, what do you think is responsible for all these conspiracy theories here and there, starting from when we started having the COVID-19 until when vaccines came available, even now that we have the vaccination?
Actually, the conspiracy theories, when you look at them one after the other, it's very difficult for you to see any of them that has any substantiation or any scientific backup. But it's so unfortunate that so many things happened. You know, luckily, the COVID-19 issue is not a Nigerian thing. It's a global thing. In fact, it's a public health emergency of international concern. So whether we like it or not, the international community will put pressure on every country that does not want to do what the country is supposed to do to prevent their citizens. Because America is spending billions of dollars providing vaccines and care for their people. Europe, they are doing the same thing. And we cannot be sleeping here, and yet we want to go and visit them. It does not make sense, because the international health regulation says that everyone has that responsibility to make sure that if there's a public health emergency of international concern like COVID-19, we have to collectively. And that is why you see for Africa, is a continental response. That's why you see Africa CDC almost everywhere. We are also working with the national government and also the subnational to make sure that we do the right thing. So at this point, I am believing that the conspiracy theory of how it started in China, it spread to other countries and the rest, and we're having it here. There were some things that were not clear, even to scientists. But as we were faithful, trying to get more information and more detail, so many things became clearer. But the masses did not want to follow suit. But that is actually exceptional, because most countries have passed that stage of conspiracy theory. Now people are signing what we call social responsibility.
Now, Doctor, the reason why I'm asking you this now we have reactions against the vaccination that is presently going on. Now, for most people, this is also a conspiracy theory. So in all of these theories, that have trailed the various stages of the COVID-19, how does the average person know the truth?
Yeah, that's why you see, when you see these conspiracy theories, the National Primary Healthcare Development Agency, the NCDC, WHO, Africa CDC, we always bring out guidelines, because we are also tracking this perception. We know sometimes is not unconnected with trust. But how long will you say you because you don't trust a system, and there is something that obviously is a global challenge? We don't need to be told that now everybody needs to come together to solve the problem. But what we do, because you will call this infodemics, that's the epidemic has come or the pandemic has come, then another wrong information,
counter information,
is also trying to wage war against what we are fighting. So the information misconception, the pushing of things that are not going to help us win the war. So we're also more tracking, using this perception. We come and start talking to people. The time of magnetism came up. We had to, you see, people are not talking about the thing being magnetic again. The time of people dying after 2 years is not there. So we monitor this and also try as much as possible to use some scientific backup to give it. Now, we are seeing real data that out of the 11 deaths we have gotten in the last few days, none, because we are taking details of all of the cases, the deaths. We are seeing now what people are reporting abroad. We are seeing it in our states that all the deaths we have seen, they are unvaccinated.
All right, so if those people were vaccinated, they would have not died.
Yes, the people who are vaccinated have 6 times more likelihood to survive.
Okay.
Or that, to survive, that is not to die, if they had been vaccinated. More than 6 times. Sometimes it could be up to 10 times. So you see, that's a possibility you have denied yourself. So for me, it could even be a sort of saying it's a bit suicidal.
Not to be vaccinated.
Not to be vaccinated, because you know. And what does COVID-19 do? There are a lot of us, especially, and the deaths are even among the elderly, although we are seeing it also in the younger people. And you know, we have different forms of comorbidity, diabetes, hypertension. So many people are hypertensive, they're not aware. So what COVID-19 does is like adding salt to injury. So when it comes upon the person, it magnifies these issues, complicates them beyond management. And that's why we could call it COVID-related death.
Okay.
So that is why this conspiracy theory of 18, I think at this stage we are. We need to go above it and collectively look for a way to get out of this situation.
Okay. Now, there are concerns that for governments in the country, the emphasis seems to have left the campaign against the COVID-19, which of course had included the safety protocols that people need to keep. As we stand now, people are saying that government seems to be emphasizing more on the vaccination. Why do you think it's like this?
Okay, I think it's actually part of the conspiracy theory we are talking about, but we're always there to inform the public, because as 2 days ago we had for the state, not even also happening nationally, we had a press briefing where we talked about
in Edo State.
In Edo State,
okay.
Yeah, 2 days ago. The governor was also present in the press briefing. So we talked about the measures we are taking and how we want to make vaccines available. But we also made it clear that even though we are targeting to have at least 60% of the citizens of Edo people vaccinated, which is in line with international targets, because we are saying if we can do 60%, at least we'll be sure that most of the people will be protected. But then we made it clear that vaccine cannot walk us out of this pandemic now, because we are in the middle of a third wave. We are having every 24 hours in Edo presently, based on the data we have, one person dies of COVID-19.
Every 24 hours?
Every 24 hours. And also average of 60 persons are detected.
And those persons are not vaccinated?
And those persons are not vaccinated. And not only that, those are reported. We have, because we also have other means of understanding what is happening at the back end. Because you recall that what we are talking about reported, not a reflection of what is happening. But we're also interested in when we report, we use some modeling to understand also what is happening. And what is happening at the back end is not also a good one. And it's a thing of people understanding these measures. So we made it clear that vaccination, because of we don't have, we are not going to have that 60% now of our people vaccinated. There's a strategy, there's a target, there is a method in which we are going to achieve that. But we said it clearly, because we are in the middle of the third wave, we need our people to observe those measures. In fact, there is going to be enforcement about that, because we can't see the positivity. As at this morning, the briefing we had this morning, every 10 persons or 100 persons tested, about 22 test positive to COVID-19.
Every 100 persons?
Every 100 persons.
22.
So we have 22%
in Edo State?
In Edo State presently. As at this morning.
Every 100 persons, 22.
22 test positive to COVID-19. That's 22%.
That's worrisome.
22% test positivity rate. So in every 10 persons you see around, 2 persons or 3 has COVID-19.
Now, what is the state government doing to ensure that we don't have this this situation?
Yes, that's what I'm saying. The government has been so concerned, because we have been, we have the COVID-19 technical committee headed by His Excellency. In fact, we meet every morning. The meeting I just left because of this discussion. We try to detail and analyze every set of this response, the laboratory pillar, the case management pillar, the infection prevention and control pillar, the coordination pillar, the vaccination pillar, we try to understand what has happened in the past 24 hours on this, and we use the gaps we see to strengthen the measures or the next step we are taking. So the government is really very, very particular about ensuring that the preventive measures, which seem to be better, the vaccination, ensure people making sure that people get tested. Before, we were having very low number of people that were testing in Edo. So we had to ask ourselves why. We deploy RDT, engage the hospitals, the private hospitals, and we introduce what we call point of care testing. Okay. And that's where we started getting this harvest. So there are a catalog of activities that the government is doing presently to make sure that the people are protected.
Okay, now because of time, we are always pressed for time on this show, but subsequently I can assure the viewers out there, and I can also assure Dr. Pius that subsequently we're going to bring you back here so that you can really share more light on what the state government is doing so as to ensure that we have a free society. Now, in every 100 persons, 22 people test positive to COVID-19. That's the situation in Edo State now, and that's very alarming. It's very, very alarming. Thank you so much, Dr. Pius, for finding time to come. Thank you so much.
Thank you so much. I think I would want to end by saying, please let us avoid close spaces. Okay. Avoid close contacts, and also avoid crowded spaces. Environment. Let us make sure we get our vaccines, because that's the only tool we can use to fight this infection. And also let us get tested if we have symptoms or if we're exposed. All right. Thank you very much. Thank you
so much. Time is always a factor on this show, but we always ensure that we bring it back here so that you can get the information. My name is Evan Sunohoge. Thank you, and stay tuned.